Hi, this is Jihan from Health and Rehabilitation channel. Welcome to this video. In this series, we will talk about the role of physical therapy in the coronavirus. This is my first attempt to make a series of videos to talk about one topic. It is a crucial topic at this time, as the government of Saudi Arabia just removed lockdown, and things are going back to normal, including opening up closed physical therapy clinics. The physical therapy profession plays a significant role in community health. There will be many individuals in the society who will be impacted by disruption of care, like patients post-joint surgeries, sport injuries, people affected by BBPV, and spinal cord injuries. So why is it crucial to understand the role of physical therapists in COVID-19? Physiotherapists often have direct contact with patients, which make them susceptible to transmission of infectious diseases. Physiotherapists are also often first contact practitioners, which means that they are in a position to take responsibilities for early identification of infectious diseases. So, they must use their professional judgment to determine when, where, and how to provide care, taking into consideration that for a clinic, it is not always optimal environment for care for anyone involved. At the beginning of this series, we must talk about 5 considerations every physical therapist has to adhere to during this pandemic. The first one is to stay current by ensuring that you and your team are well read on current COVID-19 guidelines. The WHO, the CDC, and APTA have good evolving resources. Also check with your local authority. For Saudi Arabia, the Ministry of Health website have the MOH publications in COVID-19 page. You can find the links below this video. The second consideration is to stay calm by having an objective view of the crisis we are facing. Staff, if you are a team leader, people who follows you in social media, and patients in the clinic may look to you as a leader to provide information, to help them make decisions, and also provide assurance that we can take care of them at this time of need. The third consideration is to minimize exposure in your setting. To succeed in that, you and everyone in your team need to review the infection prevention and control guidelines, practice social distancing, implement triage strategies, and reschedule non-urgent care. And even clinic closure should be at the table in emergency scenarios, such as not stocking enough personal protective equipment for everyone in your staff. The fourth consideration is to get involved in workforce planning. Where appropriate, offer services to reduce the load on emergency departments and frontline practitioners. Don't worry, we will talk about this in more details in the next video. And finally, the fifth consideration is to get educated. All staff should be trained in COVID-19 related strategies and procedures, including rehearsal of potential scenarios, such as identifying a suspected COVID-19 case on the clinic premises. Physiotherapists work in many different settings, and even if the infection prevention control guidelines are the same for everyone, the role of the physiotherapist in each setting may differ. For example, in primary care, the emphasis will be on triage and early identification of cases. In community care, we should focus on educating patients and caregivers. On the other hand, in acute care, the emphasis will be on respiratory symptoms management. As a physical therapist, what you need to understand is workforce planning, what to offer during acute and rehabilitation phase of care, and what type of personal protective equipment suit every setting and scenario. In the next video, we will talk about workforce planning. So stay tuned and stay safe. Make sure to subscribe and activate the notification to stay current with the channel. And if you like this video, please hit the like sign.